The Mayo Clinic just produced a study that stated that 1.8 million Americans are sensitive to gluten. And the thing that's astounding about that article is that they stated that 1.4 millions may not even know that they have it. And I wanted to show you a simple muscle testing procedure today that can actually check to see whether you are gluten sensitive or not. Now, admittedly, muscle testing is definitely not accepted by mainstream medicine. It is well accepted in the alternative medicine fields, and admittedly, it is weird. But the good news is that we can integrate muscle testing for a highly accurate result when compared to lab work. So, for example, if I test someone for wheat to see whether they are sensitive to it or gluten, I can verify that with lab muscle testing if the patient wants to pay for the lab work. So let me show you some of the common steps that we need to do for wheat sensitivity and verifying that through muscle testing. First thing you want to do is make sure that you are both the muscle tester and the testee is they're not dehydrated. So drink a glass of water before you test. First thing you want to do is make sure that they have a shoulder that's not having a problem. You hold up their arm, make sure that their elbow is locked in place, and gently push down. And just give it a little push. Make sure that you feel good muscle resistance. And all you say to the patient or to the person being tested is, just hold your arm and don't let me push down. And you just give it a gentle push. And this is not a grudge match, okay? So you're just giving a gentle lock. All you're feeling for is a muscle lock. Now you take your left hand, put it right on the bridge of the nose, and if you look right here, the patient looks at the wrist, I'm pushing down. And if you look at the wrist, see how there's a difference there? I mean, it goes limp. Now hold again. See, now it strengthens again. And that's a really weird phenomenon, but there's a high point of electrical charge right at the forehead there, and if you block that charge, it goes limp. And that means that the person is normal and healthy and testable. Now I can just take a piece of wheat. In this particular case, I have a vial of wheat that has a frequency of wheat in it, and I'm just going to put that next to her stomach. Now the way you find the stomach point is just go down the sternum. Just right in the middle here, you go down the sternum, and then as soon as you feel a soft spot and you push in, that's your stomach. So I'm going to put the wheat right next to the stomach point, and hers is right here. So now I'm going to see if she's sensitive, and she's sensitive to wheat. So here, hold. It's nice and strong. Here, it's not nice and strong. It just doesn't lock the muscle. So that electrical frequency is not matching with her frequency. It's causing actually a disharmonic field, and that causes the arm to weaken. Now, basically, this is very treatable, but you can first test to make sure she has this issue. And if she does, then there's ways that you can manage this. And so one of the ways you can do that is just avoid wheat, but there's also a protocol to test why she's having that wheat sensitivity. And it's very common in Northern European heritage. So I look forward to seeing you on the next video, and this is Dr. Paul from the Body Intelligence Center.